Warm welcome. You're watching 7 at 7. I'm Preeti Chaudhary. Our top focus will be the district and the city of Bhilwara in Rajasthan, recording as a city the highest number of cases of coronavirus in the country. It has now become one of the biggest hotbeds for the coronavirus. So it's day one of India's unprecedented 21-day nationwide lockdown, the largest ever in the world. All states, union territories are under complete lockdown, a curfew-like situation. All essential services, though, like vegetables, milk shops like Mother Dairy are open and people have ventured out to buy the essentials. Several shopkeepers and customers were seen wearing masks, unlike yesterday when we saw a bit of panic buying right after the announcement made by the Prime Minister. Prime Minister Modi chaired a key cabinet meeting to discuss preparedness to deal with the coronavirus crisis. India today has learned from sources that Prime Minister has asked ministers to ensure that they address problems of people during the lockdown period. Ministers participating in the meet were seen practicing social distancing.
आवश्यक सेवाओं की सारी दुकानें रोज चालू रहेगी, पूरे 21 दिन चालू रहेगी। दूध हो, दवा हो, सब्जी हो, किराना हो, राशन हो, मांस हो, पशु चारा हो, जो भी जीवनावश्यक चीजें हैं उन सब की दुकानें चालू रहेगी। लेकिन उसमें हमें क्या करना है ये दिखाने जैसा है। गुजरात के एक टाउन में, शायद आणंद में, ये इस तरह का सोशल डिस्टेंसिंग दुकानदार ने ही गोल सर्कल तैयार किए हैं 6-6 फुट पर, और एक-एक सर्कल में एक-एक आदमी खड़ा रह रहा है। ये डिसिप्लिन हमें पालने की जरूरत है।
इस लॉकडाउन में एक तरफ तो अपने को घर में रहना है और दूसरी तरफ सरकार की जिम्मेदारी है कि हम आपको जो एसेंशियल चीज़ें हैं, जो ज़िंदा रहने के लिए ज़रूरी चीज़ें हैं, वो आपको मुहैया आसानी से होती रहें, उसमें आपको कोई तकलीफ ना आए, किसी तरह की तकलीफ ना आए। तो एक तो मैं आप लोगों से हाथ जोड़ के फिर से विनती कर रहा हूँ कि प्रधानमंत्री ने जो लॉकडाउन का ऐलान किया है, ये सब लोग इसका अच्छे से पालन करें, घर से कोई बाहर ना निकले।
I want to cut across to my colleague Polumi Saha, who's joining us live. Polumi, a cabinet meeting today, but I want you to tell our viewers what is the latest that has come out of the cabinet meeting. Any chances of possibly an economic package where, daily wagers, laborers are concerned? What can we pick up in that sense?
Well, nothing concrete which the cabinet decided on as far as, the hardships that daily wagers, like you said, migrant laborers, construction workers across the country are in fact facing. Of course, construction activity has been exempted from the restrictions which have been imposed as a result of this lockdown. But there are a lot of people out there who are going without food. They do not have their essential supplies. The centre says that it is monitoring the situation on the ground. It, of course, reiterated the earlier schemes, which is part of the food scheme that the central government has been running, where wheat is given at a concessional price to the poor people, which is sold at about 27 rupees, is sold at about 2 rupees. Rice is given from 37 rupees a kilo to 3 rupees a kilo to, of course, the poorer sections of society, the economically weaker sections of society. That's about 80 crore people. But otherwise, nothing new in terms of aid has been announced for those who are suffering hardships as a result of this lockdown, which has been announced. The centre keeps pointing to the states, saying the states have announced a lot of measures. Delhi, we know, has announced certain financial aid for these migrant laborers, daily wagers, and asking them to stay back in Delhi and not try to travel or walk back to wherever they came from, to their villages if they're nearby. Please don't do that. But yes, the central government is still working on an economic package. The economic task force, unfortunately, Preeti, we're not very sure, who comprises that economic task force. It hasn't been constituted from what we hear. But then, of course, the finance minister said yesterday that an economic package is in the works.
All right, Polumi, I appreciate you for joining us. We're going to keep coming back to you for more, but I just want to shift focus. Of course, India is dealing with day one of the historic, unprecedented, but a must right now, the need of the hour for India, a 21-day lockdown. I want to shift your focus a little. I want to shift your focus right now to one district, and in one district, that one city, Bhilwara. Bhilwara district and Bhilwara city is, viewers, today facing the toughest battle where coronavirus is concerned. Why do I say that? Well, 16 cases have been recorded, which is pretty much 50% of what the state of Rajasthan has recorded till now. What's worrisome is all these 16 cases are medical professionals. We're talking about doctors, nurses, ward boys, all 16. And now the Bhilwara administration, the Rajasthan Health Ministry, is testing 30 lakhs people, or screening at least 30 lakh people, and testing thousands to see whether this virus has spread in the community. The state of Rajasthan till now has reported 36 corona positive cases. Of the 33 active cases, 16 are from the sleepy textile district of Bhilwara. 250 kilometers away from Jaipur, the Bhilwara city has become a huge cause of concern for the authorities, possibly the district becoming the hotbed of infection in the state or even in India. What is worrying is all 16 cases in Bhilwara are medical professionals, doctors, nurses, ward boys, all from one hospital. The death of an untested pneumonia patient is suspected to be source of infection for the 16 medical professionals who have tested positive. What is gravely worrisome now is the number of patients that these doctors and nurses attended to.
डॉक्टर या नर्सिंग स्टाफ का पॉजिटिव होना ज्यादा चिंता का विषय है कम्युनिटी स्प्रेडिंग के हिसाब से। तो वहाँ कर्फ्यू लगा दिया गया पूरे शहर के अंदर और पूरा जिला प्रशासन मुस्तैद है। उदयपुर से रैपिड रिस्पांस की टीम वहाँ पहुँच चुकी है और करीब मेडिकल के 300 लोगों का दल जो हाउस टू हाउस सर्वे कर रहा है, स्क्रीनिंग का काम कर रहा है, वो उस काम पे लग गए हैं, चालू कर दिया है।
302 teams have surveyed 88,275 houses. 4,52,528 people amongst them. 2,925 with symptoms have already been sent to home isolation. District hospital isolation wards have 40 people already admitted. OPD has screened 7,541 so far. Rural area teams have now screened 2,49,373 houses. And yes, 13,32,258 people. Amongst them, 8,904 have the common flu. They have all been advised home isolation. 5 private hospitals have been authorized to deal with the patients. Quarantine facilities have been boosted up with help of hotels, dharamsalas, guest houses. Community halls have been acquired by the government for isolation wards.
सबसे बढ़िया इलाज इस बीमारी का ये है कि सेल्फ आइसोलेशन, खुद के घरों में रहें, कहीं बाहर ना जाएं, कोई भी आवश्यकता हो प्रशासन को बोलें और वो आवश्यकता जितना यथाशीघ्र पूरी की जाएगी।
In the entire country, Bhilwara was the first district where a curfew was imposed. It is a district now which medical authorities in India are watching with bated breath as numbers rise, hoping this district won't be India's North Italy. Bureau Report, India Today. I want to cut across right now to my colleague Dev Ankur. He's joining me on the phone line. Dev, what in terms of numbers, the import of numbers that are coming out from Bhilwara is extremely worrisome. We are looking at thousands right now in self-isolation with flu-like symptoms. We are looking at 16 all medical professionals only from one hospital in Bhilwara city, which comprises now this number of 16, 50% of the Rajasthan positive patients. All of them are medical professionals. What is now the Rajasthan government doing to possibly avoid what could already be stage 3 community transmission in Bhilwara?
Well, clearly, Preeti, that is the worst worry or concern that the Rajasthan government has at this point in time. It does not want the situation to lead into stage 3, which is of community transmission. Right now, the entire area has been sealed. There is no one who can enter from outside, and in fact, the state government believes that this major lapse happened because of a private hospital where the practitioners, the medical practitioners, continued to operate and treat patients out there despite being coronavirus positive. The Rajasthan government believes that it was one pneumonia patient who had arrived at the hospital from where it's possible. There is a possibility that the first doctor who contracted coronavirus was because of that pneumonia patient. That is yet to be verified. That doctor later on transmitted the virus to at least 5 other practitioners, and later on several other practitioners were found to be coronavirus positive. So in total 16 medical practitioners, including doctors, nursing staff from one particular hospital, have been found to be coronavirus positive. The state government is trying to find out the antecedents of that particular patient who has come from outside, possibly from Jaipur, and that is what the state government is trying to find out. So far, there have been 3 more additions to the total. There were 13 patients of coronavirus till yesterday. 3 more have been added to the list. So clearly, Bhilwara remains a major worry for Rajasthan. In totality, there are 36 patients of coronavirus from Rajasthan, and the majority of them, 16, are from Bhilwara. The Rajasthan Health Minister is on record mentioning that that the entire district has been sealed. Earlier, it was the first district in Rajasthan to be curfewed apart from Jhunjhunu. So the Rajasthan government is trying to take steps to ensure that the situation is somehow contained. But the fact that there was a major lapse because one private hospital, the medical practitioners out there continued. So there is a possibility that this infection could have reached amongst the patients as well. But that is something which has not been detected as of now. There are 16 medical practitioners who have been found to be coronavirus positive from one hospital itself. Preeti?
All right, Dave, appreciate you joining us. We're going to cut across to you tomorrow as well. So right now, what we can tell our viewers, in the state of Rajasthan, the maximum number of tests that are being conducted in Bhilwara right now. Thousands are in isolation. 16 have tested positive, all of them, and that's the most worrisome part, are medical professionals. We're talking about doctors, nurses, ward boys. Till now, the positive cases in Bhilwara stands at 16, while Rajasthan has recorded 32 till now active positive cases. All right, so I want to now shift focus from Bhilwara and Rajasthan. I want to cut across to Punjab. Punjab is facing another peculiar problem on its own, with a lot of people coming in from foreign countries. Punjab, with 30 confirmed cases, continues to battle the coronavirus. The Punjab Chief Minister, Captain Amrinder Singh, has raised concern over 90,000 NRIs that have returned in the state in recent days. Fearing acceleration of the virus spread, the Punjab government is working on an overdrive to trace these foreign returnees. The government has said most of them have been traced, and as we speak, viewers, 30,000 NRIs coming in to Punjab have been placed under isolation. A 72-year-old man who had come in from Germany via Italy had died of the disease last week in Punjab. I want to connect right now to my colleague Manjeet Sehgal, who's joining us for the latest updates coming in from Punjab. Manjeet, every state is now, of course, developing their own set of problems. If Bhilwara in one city has become the epicenter, possibly in the entire country, of the coronavirus, in Punjab, the entire crisis now is around the 90,000 NRIs who have come in. Most of them, of 30,000 of them, are in quarantine. What about the rest?
Well, Preeti, 94,000 people have visited Punjab from October last till March, and out of 94,000, 30,000 people have been sent in the isolation, and the number of cases in Punjab have been now reported at 31. A fresh case was reported today. The worst hit district is Nawashehar, where there are 17 coronavirus positive cases. As far as the arrangements being made by the state government are concerned, the state government has given a relaxation of 3 hours between 6 to 9 a.m. to buy the milk and bread in the morning, and after 8 and between 8 to 11 a.m. to buy the groceries, but people are not happy. The state government had ordered all the deputy commissioner to provide the essential items at their doorstep, but the state government is not able to do that. As far as the cases in the neighboring Haryana are concerned, there are 32 cases, and in Chandigarh there are 8 cases, but no fresh case has been reported in Chandigarh and Himachal Pradesh during the past 36 hours. As far as the curfew is concerned, there is a clampdown. In neighboring Haryana, there is a lockdown, but there is no curfew. But the supply chain has already been broken. There is a shortage of essential items at various places. We spoke to some daily wagers here in Chandigarh who are stranded. A sizable chunk of them have already left for Bihar and Uttar Pradesh, either on foot or either on a cycle or a tricycle. They are on their way. They are stranded at many places. We also got calls from many truckers who are stranded at various places.
Right.
They belong to Punjab and Haryana.
Okay.
So the supply chain has been broken, and there is a shortage of essential items at various places.
All right, appreciate you joining us, Manjeet. So out of those 90,000 NRIs, 30,000 have been in self-quarantine, and the government of Punjab is looking now for the other 60,000 to put them in isolation. If you're in Punjab, you're in NRI, please self-quarantine yourself. I want to cut across right now from the state of Punjab to Kerala and to one district that has recorded the maximum number of corona-positive active cases in Kerala, and that is Kasaragod. Kerala remains the second worst affected state after Maharashtra with 105 confirmed cases. 4 till now have been cured of the virus. And coming to Kasaragod, in northern Kerala is a district which is turning out to be the epicenter of the outbreak in Kerala. The town has a huge link with West Asia, with thousands settled in the Gulf. Kasaragod has reported 45 of the 101 positive cases in Kerala. The government is now fearing community spread of COVID-19 virus in Kasaragod. With constant spike in cases, Kerala government has imposed severe restrictions in Kasaragod even before the centre had announced a nationwide 21-day lockdown. The town remains under full lockdown with only essential services available. I want to now connect immediately to my colleague Gopi, who's joining us. Gopi, the fresh batch of tests which was sent yesterday were to tell us whether community spread has started in Kasaragod or not. What are you getting in?
Well, Preeti, we have been told now that as of now, community spread has not been reported from Kasaragod or any other part of Kerala for that matter. So that is actually one thing the state government is actually trying to capitalize on, because they are trying everything they can to avoid any instance of community spread. And also today we had 9 new cases, but fortunately none of them are from Kasaragod, because these cases have actually come from Palakkad, Ernakulam, Pathanamthitta, Idukki and Kozhikode district. So that actually, with this, the government actually sees that they might just be able to pull off a miracle, because to contain community spread in Kasaragod can be termed as nothing less than a miracle, because that has been the way many of the people there have been dealing with this particular situation. Even after repeated warnings and restrictions and guidelines put forward, we could even see a person who came from Dubai. He was infected. He landed in the Cochin International Airport. He landed in Calicut International Airport. He traveled all the way close to Kasaragod, and he roamed around in the district for 7 days, so which has actually caused the maximum damage and maximum infections in that particular district. So to avoid a community spread in Kasaragod can be called as nothing less than miracle. That is what even the government sources are telling us off the record. But on record, they are all confident. They are all hoping that they can contain this whole coronavirus outbreak, even as the total number of COVID-19 cases have reached 118 in the state.
All right, 118. Well, that's a new number, and we're going to update our graphics there. COVID-19 cases, but the positive ones are at 101 right now, out of which 45 from Kasaragod district. As Gopi said, that to prevent community outbreak in Kasaragod would be nothing less than a miracle right now. What the government officials are saying, let's hope that miracle actually happens. So right now, we're going to keep a keen eye on 2 districts, Kasaragod district in Kerala and the Bhilwara district in Rajasthan. It's not just a district, it's actually just one city. In the Bhilwara district is the Bhilwara city, which has recorded 16 cases, all medical professionals. Continue to get you the latest on that. A quick break to stay with us. Up next is our consulting editor, Rajdeep Sabasai. Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.